Hello, and welcome to Unit 8 of Pharmacology. This chapter we're going to be looking at different forms of drugs and how they act. So when we are looking at medications, you will generally find that they come in three different forms. It'll be a liquid, a solid, or somewhere in between, a semi-solid. Liquid preparations actually have quite a few options. You'll see that the book goes into the details of each one of these. Truly, you don't see spirits all that often anymore. That was something I think you saw in the past. Fluid extracts, again, is medication you don't see as often. You definitely see that in cooking, vanilla extract kind of thing. Lotions, definitely see a lot of those, though I would say creams are more common. A liniment is actually something, it's like Aspercreme or Bengay. You rub it on the surface of the skin and it actually creates heat. So it has its own special term. We have sprays. That's when you think of like nasal sprays or throat spray, chloroseptic. And then there are aerosols. When you have a steroid, there is, an antibiotic. There's an antibiotic that's in an aerosol spray. There are certain applications where people have the type of infection where that type of disbursement is appropriate. We can also see that there are emulsions, and emulsions are kind of like when you think of oil and vinegar. In Italian dressing, it's oil and water kind of mixed all together, and you got to shake it up to make sure that it's mixed together. A solution is when you actually can dissolve the medication or the items into the liquid, and so it's clear. Many solutions, like nail lacquer, there's a cyclopirox. There are also eye drops are generally solutions. Suspensions are when we can't actually get the medication to dissolve into the liquid. So what we have to do is actually take the actual medication and suspend it in the liquid. So when you think of liquid antibiotics for children, why does it always say shake well before use? It's because it's a suspension, and the actual medication itself will settle out when it just sits there, but when you shake it up, it'll actually sit in the liquid for a certain amount of time. Syrups are flavored. Elixirs and tinctures have kind of an alcohol component to them. Elixirs have sugar, so they taste good, whereas tinctures generally aren't flavored. And you don't see much of tinctures these days, other than sometimes you can get iodine to use for different purposes, and that's usually called a tincture. And when we look at solid and semi-solid preparations, you're going to see this more often than the liquid. And that's because there's a lot of flexibility when you're looking at those preparations, especially when it comes to tablets. And this is probably what we run into the most when we're looking at medications, is the use of tablets. There's different types of tablets, and we'll review those real quick, just so you have an idea of where these terms come from. Enteric coated, you can see that with aspirin over the counter. When it's enteric coated, it's designed to keep it from dissolving in the stomach. And the reason we do that is we want to help to alleviate any stomach upset that may occur, or if we want to delay absorption into the body. But enteric coated generally is used to help alleviate symptoms in the stomach. You may see the term buccal. When you are looking at like nicotine gum, that's a buccal tab, and that is meant to be placed between the cheek and the gums. And essentially, it's just there to kind of dissolve or release its medication. It's not meant to be chewed like gum. It is not meant to be swallowed. It's meant to just sit there and the medication gets absorbed through the mouth. Sublingual, that is below the tongue. So there are medications that you can put below the tongue. It will dissolve, and we actually do absorb medication through the bottom of our mouth. And the advantage of doing that is you don't have to swallow it. It doesn't have to stay in the stomach to get absorbed. It can actually be absorbed through the mouth. That offers for quick relief. Also, for people who can't keep medication down or can't swallow pills, that might be an option. You'll see sublingual tabs with when people have the nitro tabs for when they're having chest pain. Those are sublingual. You put them below the tongue. Occasionally, you'll see layered tabs. Those are usually designed to either offer two medications in one, or perhaps one's a fast dissolving and then one takes longer. So you get immediate action, and then there's also action down the road, so it lasts longer. Scored tablets are quite common. Scored tablets are the ones that have the line down the middle. And a scoring on a tablet is a really good sign that you can split those tablets. Like in enteric-coated tablets, you wouldn't want to split those in half because then you're disrupting the coating and the medication on the inside will be able to be absorbed in the stomach. The layered tabs, they might be scored, but a scored tab, why would you do that? If you look at the opportunity to adjust the dosing, sometimes being able to take a half tab or a third tab is appropriate for some patients. So you'll see quite a few of the tablets that are not extended release, are just plain old tablets, will be scored to allow for them to be split, and that gives us some flexibility as far as dosing goes. We have lots of chewable tablets out there. You think of the vitamins that the kiddos have, especially for children. That seems to be popular. We have chewable antibiotics. We have chewable asthma medication. A lot of the antihistamines can come in a chewable form, and that is just to make it easier for the kiddos to be able to take their meds, and for some adults that may not be able to swallow pills. We do have vaginal tablets, and I know that sounds a little odd, but there is a medication called Vagifem, and it is in a tablet form, and it is placed vaginally. So when people are talking about tablets, there is the opportunity to place them not just in your mouth. So you do have to think about that when you are sending medication. If there's any chance it could be placed other than the mouth, you do need to specify that. We have effervescent. That's when it creates the bubbles. That's your Alka-Seltzer that you usually think of. Those are not, I'd say, as common as far as medications that are dispensed through the pharmacy. You really see that, like I said, the Alka-Seltzer, I don't think I've seen it much anywhere else other than maybe the emergency powder, but that's not a tab, so doesn't count. All right, we also have capsules. Capsules are the containers, and you put medication in them, and those are the little bullets that you think of. Capsules can be made out of gelatin. They can also be made from a vegetable source. So for those out there who have a gluten intolerance or have an objection to using animal products, the gelatin, you can actually use the vegetable-based capsules. And those capsules, sometimes you'll see that the capsules will be filled with powder. Sometimes they'll be filled with little balls of medication. The powder generally is immediate release. When it has the little balls of medication, that's usually an indication that it's some sort of controlled release. And what happens is once the capsule enclosure dissolves, then those medications, the little balls of medication, will then dissolve over time. We do have gel caps. Those are, when you think of over-the-counter ibuprofen, they have those little liquid-filled capsules. They're not the two-piece, they're one solid piece. Those, for some people, they feel like they act faster. Sometimes they're a little easier to swallow. It's a way to deliver medication already dissolved rather than having it dissolve in your stomach. So there are some advantages to gel caps. We also have caplets, and essentially a caplet is a combination of a tablet and a capsule. So it's a tablet that's in a capsule shape. And why would someone use a caplet? I think the shape of a capsule is sometimes easier to swallow than the roundness of a tablet. So they do the caplet where you get the shape, but you're also not worrying about the expense of a capsule. And generally, capsules are usually a little more expensive than tablets. Tablets are a little bit cheaper to make. We also have troches and lozenges. Now, there is a misspelling here. You'll see it says Torches. It should be TRO. It's a troche or lozenge. And those are designed to be dissolved in the mouth. Lozenge, you're thinking of your Hall's cough drops. Troches, there is an antifungal medication called clotrimazole that when people get a yeast infection in the mouth, it's called thrush. You can use the troches to help fight that. And basically, it's just like a lozenge. It just dissolves in the mouth. It's not meant to be swallowed or chewed. We have suppositories. Suppositories are usually a semi-solid presentation that is designed to dissolve at body temperature. Suppositories can go in 3 different spots. The most common you'll hear is rectal. There's rectal suppositories, but you can also place them vaginally and also in the urethra. You don't see those as often. Like I said, most common it will be rectally, but they do exist in all 3 forms. Suppositories, why would you use those? In a situation where someone is unable to keep medication down and we need some quick absorption, we need quick action. A suppository actually will allow for quick absorption of the medication, which will then allow it to act quickly. The other situation where you might use a suppository is to provide local action in that area. So if there is a yeast infection in the vaginal area, you would want to use a vaginal suppository to treat that area. There's no reason to take systemic medication or a tablet when you're just treating that one area of the body. We have topical preparations, ointments. So that is when you think of like Vaseline. That's an ointment. It's that kind of thick petroleum jelly kind of material. And the other item would be cream. And that's more of when you think of the lotions that we put on our body. Why would you use a cream or an ointment? A lot of times it can depend on where you're applying it or why you're applying it. Ointments a lot of times are going to be used in an area where the skin is already irritated and needs some protection. The ointment will actually kind of sit on top and provide some protection, whereas creams will actually soak in. So in areas where you don't want to be having medication sitting on the surface of the skin, you would tend to use a cream. So it just kind of depends on what you're using it for, on whether you choose a cream or an ointment. But a lot of items that we'll use as medication are available in both forms, so you just have to choose what's appropriate for the patient. Now we're looking at other drug delivery systems. There are some unique ones out there. Transdermal, so that's when you place something on the skin. And it's usually a patch or a disc, and it has 4 layers. So it'll have the top, which is what we call the backing. No medication will come out of that. That will keep people safe that aren't using the medication. So that's the outside that you would see if it was on someone's body. Below that backing is the drug reservoir. That's where the medication lives until it's distributed. And then below that, there's a membrane, and that will control the drug release. So usually patches will release medication at a specified rate. So if you're looking at nicotine patches, for example, it will distribute or let the nicotine go at a certain rate, whether that's 7 milligrams a day, 14 milligrams a day. And then there's the adhesive. The one thing I have noticed with the transdermal systems is adhesive can vary from brand to brand. So you may find that some patients are particular to a certain brand or a certain type of patch. That is fair. I think some stick better than others. You'll also find that there are some people who are very sensitive to adhesive. Always make sure you encourage your patients to rotate sites when they're using patches. If you keep applying a patch to the same place, eventually that adhesive is going to damage the skin. So most medications that are applied on the skin as a patch will allow for more than one place on the body. And that's the other thing to look at as well, is when you're thinking about transdermal systems, you want to make sure the patient's aware of the appropriate places to apply those patches, because it will vary from medication to medication. though the directions should include that information, and your friendly local pharmacist can also help you with that. Some other unique systems, they have one that's an ocular system, and what they do is they actually place it in that lower eyelid area, and it just basically releases medication over time. Honestly, I've never had an interaction with this particular system specifically, but I think you probably go through your eye doctor to do something like this. I don't think it's something that someone would do on their own, but generally it's just not that common. There are implantable devices, especially you'll see more and more with insulin, people with insulin pumps and such. Also used for chemotherapy, where the reason you would do this is it will provide continuous release of medication, and it's something where the patient needs to deliver the medication into the body. And rather than having them continuously stick themselves with a needle, continuous injections, there's the implantation of the device. And then you can just add the medication, and it's less discomfort for the patient, especially if it's a long-term treatment like insulin or chemotherapy can last weeks. It's easier for people to just have that one procedure done, implant the device, and then you can just refill it with the medication. All right, and then we have dissolving tabs, and this is somewhat similar to the sublingual tabs and the fact that you don't have to swallow them, but these actually are designed to dissolve just in the mouth. You don't have to put it below your tongue. You can put it on the tongue and it will dissolve. You may have seen Claritin has dissolving tabs. That's antihistamine. You can use that for kids. There's an anti-nausea medication that is called ondansetron or Zofran, and they have a form of orally disintegrating tabs. And essentially what that does, in some cases, it allows the medication to be delivered, again, without having to go into the stomach. If you have someone who's not feeling well and can't keep medication down, we have to find unique ways to deliver that medication. And if we can do it through the mouth, rather than having to go into the stomach, that can be helpful. We also have patients who have difficulty with swallowing tablets, and especially patients who, well, we talked about kids, but there are geriatric patients who also have a hard time, or there may be patients who just never learned how to swallow a tablet. And so we try to find unique ways to help them still get their medication without having to go to injections, and dissolving tabs are a situation where we could do that. All right, so that is drug delivery systems. All right, so when we're looking at medication, oral I think is by far the most common that you will see. The second most common is parenteral, and that means injection. And there are different ways to deliver parenteral medication. We'll go through the terms now. Subcutaneous, that's the one that goes below the skin, below cutaneous skin. And you'll find medications like insulin are delivered subcutaneously. Another common delivery method is intramuscular. That is into the muscle, intramuscular. It's common with vaccines. The flu vaccine is generally delivered into the muscle, or the tetanus, Tdap, you probably have heard of that. These medications are deposited into the muscle. There are some that are actually even designed to, they call it a depot shot, and it actually sits in the muscle and distributes over time. There are some medications, some antipsychotics, that can be injected once every 4 weeks and cover a patient throughout that time. Intradermal is another option. That is into the dermis, the skin. That I don't see as often. There was a flu shot a couple of years ago that was available in that form. It really didn't take off all that much, so I haven't seen many intradermal options out there, but they are out there. That is an option to be able to put it into the skin. Intravenous, so that's into the vein, or the term IV. If you've heard the term IV, that's intravenous. Those are medications that we put directly into the bloodstream. And, you would find that Antibiotics can be delivered intravenously because then that actually distributes the medication throughout the body very quickly. And there are situations where that would be appropriate. Generally, intravenous is going to be delivered in a healthcare setting. You won't see intravenous in the pharmacy or out in people's homes unless they had a caregiver or a doctor or physician in their home. Another item that you'd see is intra-articular, and that means into the joint. There are situations, I've seen steroids, you hear someone getting a cortisone shot, a lot of times that can go into the joint, and that helps with inflammation. There are certain situations where intra-articular are appropriate, but that is generally always going to be in a healthcare setting. It's not something you'd see out in the field or in the pharmacy. All right, so we talked about administration of drugs. Now we're going to talk about classification. And this is going to be kind of a broad overview. We're going to get more in depth with these different classifications of medications. But for right now, we're going to kind of do a broad overview. And I will say the table on the table 8.1 is actually a very good resource for you to start with as far as learning the different medications and the different classifications. So I encourage you to mark those pages. And if you ever need a quick review.
Mommy.
All right, sorry about that, guys. I am a mom. I've got a 3-year-old daughter, and I am recording these lectures from my home. So occasionally you're probably going to hear a "Hey, Mom." Let's get back to, all right, so I was talking about the table. When we're looking at the classification of drugs, there's multiple ways to kind of organize them. We were talking about preparation. That's when we were looking at, solids, liquids, intravenous, parenteral, oral, that kind of thing. We can also define medications through therapeutic action, meaning how do they work? So you may have an analgesic that can be in a liquid form, a solid form, a topical form. There may be different preparations, but they all have the same therapeutic action, meaning how they treat or relieve pain, treat problems, that sort of thing. Like I said, so 8.1, it's a good place to start, and I know it seems like a lot of information, and it is, but it is a great way to classify medications. So like I said, mark that in your book. All right. So when we're looking at actions of drugs, there's lots of different ways that they can work. When we look at medications, they can act directly on the body, and they can actually change the process. If you're looking at medication that it lowers cholesterol, statins, what they do is they actually make the liver stop producing as much cholesterol. So they act directly onto the body to change a result. You also can have medication that acts on a foreign substance, an invader. Antibiotics fight bacteria. You can also replace missing items. Hormones are a great example of that. You'll see a lot of hormone preparations, replacement of estrogen, testosterone, all those items that can act on the body. So those are kind of a way of also classifying medications. When you're looking at how medications act, there are terms that we use that are helpful to know, just so as people are referring to medications as agonists or such, you'll have an idea of what they're doing. An agonist is something that will land on a receptor of a cell and make the cell do something. It will increase an activity of some sort. It's turning up the volume, essentially. An antagonist is the opposite of that. It will sit on the receptor and not let the receptor turn on. I think of it as an antagonist as a bouncer who's not going to let you into the bar. Okay, an antagonist is going to block anybody from being able to turn that receptor on and let it do its process. So agonist makes things go, antagonist keeps things from happening. They'll talk about selective action, and that's where it's a specific type of action, whether it's increasing or decreasing. They talk about stimulants. The book particularly likes to talk about caffeine, I've noticed. That does increase cell activity. It moves things more quickly. Pseudoephedrine is also a stimulant as well. And many depressants out there, and those slow things down. We are also can look at local action, and that's when we're looking at, we were talking about creams, liniments, ointments, and such. That's going to provide a local action. And why would you want that? Well, a lot of times when you have a problem in one spot, you don't need to put medication throughout the whole body. There are side effects that can go along with medication, and if we can remove those side effects, or at least make them less likely to happen by applying medication to a specific area, then sometimes we're able to do that. Remote action is when you administer a medication and then it goes somewhere else to deliver its duty. There's sometimes chemotherapy can be in that type of area, or something that is targets specific types of cells can be a remote action. Systemic action is probably the most common when you're looking at oral medication. If you take medication orally, it's generally going to go throughout the body. And systemic action is pretty common, or probably one of the most common things you're going to see. Specific, that goes in line with remote action. Specific organisms, antibiotics will fight bacteria. They don't hurt other cells. We have the term synergistic, and that's when one drug helps another drug work better. Augmentin is a great example of that, where we add an acid component to amoxicillin, and the acid component actually boosts the ability of amoxicillin to help fight bacteria. So it's a synergistic relationship. It helps to improve the action. Now, when we look at medication and how it acts on the body, this is pharmacokinetics. We look at medication as it comes into the body, absorption. That can be through the mouth, the stomach, the skin. Then there's distribution, and that's where does the medication go after it enters the body. And sometimes that can be in the bloodstream, sometimes that will be through tissues. And then how does the medication change while it's in the body? How does it get changed into its active form, or get deactivated? How does it actually, the chemical structure change? And then finally there's excretion. And how do we get rid of the medication? How do we get it out of the body? These different stages can be important when we're looking at side effects on medications. A lot of times metabolism can be affected by other drugs. We call those drug interactions. And so we're worried about medication being removed too quickly, or medication not leaving the body as quickly as we want, which flows into undesirable actions of drugs. So a side effect. A side effect is something that happens other than what's intended at a therapeutic dose. So side effects are when we're looking at medication dosed at normal levels. We're not looking at toxic or lethal or anything like that. What we're looking at is, if I take a therapeutic dose of amoxicillin and I get diarrhea, that's a side effect. Okay. So for some medications, that side effect may limit how useful that drug is. There are patients who can't tolerate the side effects of some antibiotics, and so they can't use them. That is different from an allergic reaction. An allergic reaction, while a side effect, is kind of its own unique thing in the fact that it's the body saying, I don't like this medication. It is something I don't want in my body. And so the immune system kicks in and it can cause rashes, itching, up to the point of even causing possible anaphylaxis, meaning you can't breathe. And so we do want to be careful when we're looking at medications and people. We want to make sure we review allergies every time, because we certainly don't want to put anyone in a situation where they have a problem with the medication if we already know that it could be an issue for them. They do have a place where we can actually report adverse reactions. This can be helpful, especially with new medications. There are situations where we discover that a medication has a long-term effect that they didn't find in their research trials. There's a diabetes medication that they found actually hurts the pancreas in the long run. And so they found that it's generally not a good medication anymore. And that was through reporting through the FDA. So that phone number you can use to report any adverse reactions people are having to medications. So drug interactions. These, especially with people taking a lot of over-the-counter items or herbal preparations, drug interactions are an issue. Also, when you're looking at people with complicated medication regimens, we have to look at drug interactions. And there's different ways that drugs can interact with each other. One is the potentiates, and that's similar to like the synergistic, except it's not a planned synergy. We don't want the drug to be able to work better. And that's a situation where maybe we need to reduce the dose of an item because we added another drug to the routine. There's also a situation where we can diminish the effect of a medication by adding another. An example they have here on the slide is antibiotics and oral contraceptives. Antibiotics can actually make you eliminate the estrogen more quickly out of your body, and then the pills don't work as well. So you do have to be careful when you're adding medications together. Great thing is that we have a lot of tools and resources out there that will help you to determine if there are drug interactions. The Epocrates that I mentioned in Unit 7, you can put a list of drugs into that app and it will tell you if there are drug interactions. Also, most computer systems that you'll be using and where you're putting in people's medications and such, you should be able to get notifications as far as whether there's a drug interaction or not. And your pharmacist will check in with you as well if we see something that doesn't look quite right. All right, well, that takes us to the end of Unit 8 and the end of forms of drugs and how they act. At this point, I'll encourage you to look at the review questions, work on your homework. We are 2 lectures in before we get to the 4th one. At the 4th one is when we start the test. If you have any questions or concerns, again, go to the forum, go ahead and post it. You may also see someone who's already posted that question. And as always, I hope you're having a good week, and I'll see you next time for Unit 9.